Hey, everybody, this is Robert, and welcome to today's show. Now, like countries all across the globe, the Philippines is experiencing an increase in COVID 19 cases. So, what is the current situation in the Philippines? Well, joining me today to look at this issue is Edsel Maurice Salvana, MD. Dr. Salvana is director of the Institute of Molecular Biology and Biotechnology at the University of the Philippines, Manila, and he is a renowned infectious disease expert. Dr. Salvana, welcome to the show, sir.
Good morning, Robert, and good evening over there. It's great to be here.
I appreciate you taking the time to join me. Well, in the Philippines, I keep a close eye on this. It's pretty much being seen in Southeast Asia in general. The numbers are rising, but at least in the Philippines, the severe cases are down. So, Dr. Salvana, what is the bird's eye view of the COVID-19 pandemic in the Philippines, particularly after the introduction of the Delta variant?
Right, Robert. So the Philippines has had one of the bigger outbreaks in Southeast Asia. And it's also, there's a whole lot of reasons for that. First of all, even though we were one of the first countries to shut down its capital back in March 2020, we did not stop repatriating our returning overseas Filipinos. And so that actually kind of became a way for the variants to come in. And so even though we've actually kept deaths relatively low, if we look at our ranking in terms of deaths per million, it's about 287, which is 118th in the world. And that's 8 times lower than the United States. So the early lockdowns in the Philippines actually prevented a lot of deaths because they decreased the risk of the healthcare system getting overwhelmed. It's pretty close. But the problem then became that because we continued to repatriate Filipinos, unlike a lot of other countries, for instance, New Zealand, Australia, they really didn't bring in anybody as much as possible. We've repatriated about 1.4 million overseas Filipinos for humanitarian reasons. These guys have nowhere else to go.
Right.
And WHO, which our in-country WHO, has said that given the circumstances, given the resource limitations in the Philippines has actually done well, considering that we repatriated all those people, and with the limited resources, limited healthcare, we've kept deaths low. And even now, with the Delta spike that we're seeing, we're trying to keep a handle on it. And as we've seen in Malaysia, we've seen in Thailand, it's really exploded. We've even done this preemptive lockdown a couple of weeks ago. And even though right now our healthcare system is pretty stressed, based on the projections, we're actually on the low side. And so hopefully those interventions will continue to kick in the next few weeks.
Yeah. Manila is a huge city for viewers that are not familiar, 10 million plus people, right?
Right.
How are things in Manila with that high density there? And what other locations around the country are you seeing a big burden of coronavirus today?
Right. So yeah, Manila's a huge city, and it also sprawls. We call it the National Capital Region, and there's also big megacities surrounding it. Right now, we're seeing a spike in cases, which seems to be driven by Delta. We're peaking at about 4,000 cases a day. And right now, we're hopefully starting to see a slowdown because it's plateauing. We did our preemptive lockdowns about 2 weeks ago, and we know that those lockdowns take about 2 to 3 weeks to take effect. The hospitals are full, and the other problem is that the surrounding cities, which have less healthcare capacity, are also dumping their patients into Metro Manila, and so it's been a challenge. However, compared to, we also had a spike that was really beta and alpha driven a few months ago in April. At that time, the healthcare system was also overwhelmed. We had about 70 to 100 people lined up in the ERs. This time around, I still see patients actually. What I've seen is that the numbers in the ER, which is still bad because you don't want a line in the ER, it was about 10 to 20. So the peak from April was still higher than the peak that we're seeing in NCR now. But I also suspect that a lot of the other surrounding areas are sending patients our way in Metro Manila because their healthcare system is overwhelmed. Another place that is really in big trouble is Cebu, which is in Region 7, one of the oldest cities in Asia. Actually, that's where that's where Magellan was. That's where one of the places that Magellan went to when he arrived in the Philippines. And part of the problem there is that the healthcare system is not as big as that of Metro Manila, and they've really had a scary Delta spike. And so now they're actually seeing some of the highest death rates in the Philippines.
Yeah. Um, I just recently started following you on Facebook and catch some of your quotes and your posts and very interesting stuff. And one thing I slapped me in the face was, yeah, you're a huge proponent of the vaccines. And what vaccines are available in the country? And if you're getting vaccines that are not, say, Pfizer and Moderna, how does the efficacy compare?
Right. So we have a whole bunch of vaccines. So we have Pfizer, we do have Moderna, we have Astra, we have Sinovac, which was the first vaccine that we were able to procure through China. Sinopharm is coming. Gamaleya, which is the Russian vaccine, is also here in small quantities. And what we're seeing actually in terms of the efficacy is that for severe disease, there's been very few people who died who were fully vaccinated, meaning at least 2 weeks from the second dose. We started vaccinating people back in March, and this was mostly Sinovac. So about 5 million people have already received Sinovac. It's more than that. The cutoff for this is August 1. But out of the 5 million, there were about 90 plus breakthrough infections, and only one person died. The next most used vaccine is Astra, which has about 980,000 people who have been fully vaccinated. And the breakthroughs, I think, are about 30, and no one died. The others are a little too new. Pfizer has came in around May. There's one death, but we're not sure if that was fully vaccinated or not. So overall, it's actually been very, very good in terms of preventing severe disease and even breakthrough. Of course, we're going to see a lot more breakthrough now that Delta is here.
Yeah. And the Philippines really didn't start vaccinating until, I don't know, a few months after the United States actually started. And how are the vaccination rates in your country? And is that where you like to see it?
Right. Yeah. So originally we were trying to target 500,000 vaccines per day, and that was a tall order, but we've actually exceeded that. We've gotten up to like 700,000 in a day. In Metro Manila alone, we've been able to give more than 200,000 shots a day. And I suspect because the local governments are really putting they're really putting a lot of effort into this, and it's been incredible to see actually, to the point that I think that we could probably vaccinate more if we even had an even better supply at this point. And that's really what's limiting the extent of vaccination, because as you know, global supplies are a little short. Plus this issue of people wanting to get boosters, it's just making global inequity for vaccines even worse.
Yeah. One thing I always wonder when it comes to vaccination in the Philippines is whether it be COVID, whether it be measles, is a couple of years ago, 2, 3 years ago, was the dengue fever vaccine, and hundreds of thousands of children got it, and it didn't work out so well. Have you noticed that that's created any kind of significant hesitancy because of that history?
Right. Yeah. Well, we did see that about a year or two after that fiasco, and then there was this big measles outbreak, and everyone came flocking back for
Yeah. Okay.
vaccination.
Good. Good.
But there is some issues with that, though. That do linger. But now that the vaccines are here, and people are seeing that they do work, it's actually much improved. The only problem now is brand preference.
Gotcha. All right. So you're a prominent physician in your country, and you're actually well known here in the United States. Also, you do some work here in the U.S. Um, what do you tell your fellow Filipinos that are concerned about the vaccine?
Right. So usually what I do is, first of all, I put myself out there. I was number two, the number two person who got the vaccine right after the Philippine General Hospital director. And I'm still alive. I see COVID patients every day, and I haven't gotten a booster either. And I also got the Chinese vaccine because people are hesitant to get the Chinese vaccine. So I think first and foremost, that's the most important thing, is that you're putting yourself out there and saying, look, I'm still alive. I see patients. I'm high risk. And this vaccine clearly is protecting me. Second is that, I think it's important to acknowledge that, not everyone's an anti-vaxxer. There's really just people who are just vaccine hesitant because there's just too much noise on social media. So as doctors, as public health people, we really need to put ourselves out there. We get trolled, we get hit all the time, but it is part of the practice of medicine now, like it or not. And so we go out there, we try to correct the misinformation, we guide people to good sources of information, and that's what we can do. I'm a big fan of Dr. Peter Hotez, who is very prominent there. He's a hookworm guy. I'm a worm guy also, so I've known him
Okay.
even before he had his vaccine. I even wrote a chapter for one of his books
Oh,
before.
okay. Good.
But the thing about it is that Dr. Hotez, who has been beaten up severely on social media by a lot of anti-vaxxers, is really advocating a more aggressive counterattack because we've let this simmer and brew for too long, that we're trying to take the higher road. We're physicians after all. We're just gonna slay them with all this good data, and unfortunately, it's not working, and it's costing lives. So I think we have to be a little bit more proactive. Not lose the moral high ground, obviously, but I think that we really do have, as a profession, need to get our act together, learn to communicate properly with the public, and push back on bad information.
Yeah. Do you think public health is taking a bruising during this?
Oh yeah, absolutely.
Yeah.
I think that we've really been it's been difficult to control the narrative because social media has just really exploded. Everyone's a content provider. Everyone's an expert now. They think that they know that they know how vaccines work by reading through Google. And one of the things that is kind of a pet peeve of mine is everybody keeps waving antibody data in my face. And I say, it's not that simple. We have T cells, antibody levels wane naturally, but if you get re-exposed, they go back up. And we just have to keep hammering this issue that data changes, and the best kind of data is clinical data. What actually happens to people, and all these preprints that people keep hitting you with, especially ones that get retracted,
Mhm.
especially like on ivermectin. These aren't properly vetted, and they can change. And it's really important people appreciate that there is a process to figure out which information is correct.
Let me ask you a couple more questions about vaccines. I just want to get your view, A, on young children, and your views on the third shot or the booster shot.
Right. So for kids, we're seeing more and more people, more kids infected, and that's happening in the United States as well. I think it's really just a function of the fact that Delta is so infectious, and especially in the United States, a lot more adults are already vaccinated. So you will see the proportions of kids who are not vaccinated increase naturally. We're seeing that in the Philippines as well. But it seems that the risk of dying of severe disease remains low for young people. And so I would like to get all the kids vaccinated as soon as possible, but we still have to follow the prioritization framework. If there are enough vaccines, then we should start offering it. But again, the equation for risk benefit, especially with newer vaccines with emergency use authorization, is not as compelling as that for people who are above 60 years old who have a 10% risk of dying. So I think that let's get the studies going. For instance, we know Pfizer is already approved for 12 and above, and there are studies for younger than that. Same with Sinovac in China, is already approved for 3 to 17 years old, and we're evaluating it here in the Philippines. So those things we would like to protect our children. We do have a prioritization framework, but these need to be done properly. Now, for the boosters, I have a couple of things that obviously from a coming from a resource limited setting, I have a big beef with vaccine inequity because we know right now that our vaccines are pretty good for protecting against severe disease, about 90% effective, all the vaccines across the board. The real differences are in terms of efficacy against preventing mild to moderate clinical disease and even blocking transmission. And those are all thrown out the window right now with Delta, actually, because the latest data from Pfizer says that for preventing clinical disease, Pfizer is down to about 60%. There was even some data from Israel that was like 32%. But the protection against severe disease remains above 90%. So my thought process here is, okay, fine, you guys have enough vaccines and you're boosting your most vulnerable. Makes sense because your antibody levels go up. However, consider those antibodies are actually antibodies against the old virus. They're not tweaked against the variants. So I don't know how much more you're going to get in terms of protection when you boost antibody levels for antibodies that don't work very well in the first place. I think the more logical way of boosting is these new tweaked vaccines that are already in clinical trials against Delta, against Alpha, against Beta. And that makes a lot more sense than, boosting with something that's against an old virus when that vaccine can protect other people against severe disease. It just doesn't sound right to me. I think somebody described it like you're already getting your second helping, and a lot of people haven't eaten yet. So I think that's a real problem.
Yeah. During most of last year, we have family that are in the Philippines, and the mitigation efforts, the lockdowns, were very, 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 very strict. I guess what I'm asking is, how are things now?
Right. So the lockdowns have always been meant to be a temporizing measure, especially when our hospitals are getting overrun. So when we ran the models, I mean, they worked in the past. March 2020 lockdown saved over 200,000 Filipino lives. That's a conservative estimate because if we look at places like Mexico that locked down about 10 days after us, and that's not even without a lockdown. Place that locked down 10 days after us. Their death rates have been like they've had more than 200,000 deaths. We're at 32,000 right now.
Right.
So they clearly worked in the early going because number one, people were scared, and we hadn't depleted all these resources yet. People still had some savings. They stayed home because everyone was scared, and we were still trying to figure out what we were doing with patients. We didn't have all these drugs like dexamethasone, remdesivir. We didn't know what worked. But now with the last lockdown, so the thought process was Delta hit Malaysia, Indonesia really, really hard. And so we didn't want that scenario happening. And we ran all the models, whether you do strict lockdowns, semi-strict lockdowns, or whatever. Whatever you did, the healthcare system was going to take a hit. There was this tsunami of Delta that was coming. And so the only thing that we thought would work was to do a preemptive lockdown. This was when our healthcare system capacity was only at 54%. That's kind of unheard of. You lock down the whole place, you kill thousands of jobs, you kill businesses. But because we saw that it was really going to hit us hard. And so what ended up happening was we locked down and then we kind of loosened a little bit, but the cases were still on the rise. As you know, these things take time to take effect. And right now, based on the projections, we're still on the low end of the projections, which is a good thing because we're not getting hit as much as we thought we would be. And on top of that, we're seeing the severe plus critical percentage of the number of cases actually going down. And I think this is because of vaccination. 2 weeks ago, the critical plus the severe percentage of cases was at 2.8%. Now with an enhanced vaccination program all over, it's down to 1.8%, and I think that's the only reason we're still at least able to admit some patients. If we had not embarked on that enhanced vaccination program a few weeks ago, we'd probably be completely overrun right now.
Yeah. Let me ask you one last question, and I'm going to ask you to look into your crystal ball. Um, where do you see things going with this pandemic going forward?
Right. So, I mean, last year was all about lockdowns. This year, I think we're going to have to move forward, and the way to do that is really to have a very good vaccination program. Because I tell people, last year, if you had 100,000 cases, 3% of those people were going to die, if you didn't get your act together. Nowadays, if we vaccinate as many people as we can, that's going to be down to 0.3%. Still not a great number, but it's manageable in terms of, if you keep the number of cases manageable, it's not going to overwhelm your healthcare system. So the important thing is, I mean, we live with the flu, we live with dengue the whole year out. We have these outbreaks, and we don't close society. It's gotten to the point where the equation has changed. Delta is so contagious that what used to work for the other viruses is not working anymore. The other thing is, people are really tired. We look at our mobility data with this last lockdown. It wasn't even half of what it was last March. So you're paying the same cost in terms of lockdowns, but you're getting less and less returns, and that doesn't work. That's like with antibiotics becoming resistant for two reasons. First, Delta is more transmissible, and second, people are sick and tired of the pandemic. And really, the only way that you can move forward is to get people to vaccinate, so that their risk of getting severe disease goes down tenfold. But at the same time, especially for the more vulnerable populations, for instance, people above 60, their baseline risk of dying from COVID is 10%. But if you vaccinate them, it's 1%. 1% is still horrible, I mean, from an infectious disease standpoint. So you still have to continue protecting them. And so I think for the foreseeable future, aside from the vaccination, we'll have to wear masks, especially to protect the more vulnerable members of society, at least until we come up with better vaccines.
All right, very good. Well, I appreciate you taking the time to share your thoughts with us. And I want to thank you, Dr. Edsel Salvana, for your time and your expertise. I really appreciate it.
Thanks, Robert. Stay safe.